This portion of the lecture picks up, it's a continuation from section 1, and it talks about family structures. Okay, I mentioned divorce before, and we're going to talk a little bit about it now because it's a major force when you look at what's happening with families. The United States has the highest divorce rate in the world. It's been hovering for decades now at about 50%. Now, if you look, though, more closely at divorce, we know that about half of divorces involve children under the age of 18. And when you look at these divorces, we know about 2/3 of divorced parents remarry, and about half of the children of these unions experience divorce again. As I said, when people divorce, they don't necessarily decide they're going to be alone forever. Hope springs eternal, and folks do think, well, I hope I can find love again. And human beings desire companionship. They desire to have someone that they'll share their lives with. And if you work in an early learning setting, this is something that you're going to deal with your families, because when you look at the developmental cycle of how we form families, what happens is that people generally get married, and they're married for a few years, 1, 2, 3, maybe 4 years, and then they have a child. And then after that child is a few years old, 2, 3, 4, they have another child. And that means, and then right around the time that they have that second child, or certainly after they've had that first child, maybe a little bit of time goes by, another year or two, and then you start to get into this time where marriages tend to be a little bit more fragile anyway. They call it the 7-year itch. Maybe some of you have heard the term 7-year itch, but there's something about the window of the 6th to 8th year of marriage that folks kind of look around and they think, well, those first few years, that was pretty good. We had some hard times, but still it was pretty good. And then I spent a few years trying to figure out how we were going to work through stuff. And then we had a child, and now we're settled into a routine. And I'm looking at you and thinking, I don't know if I can live with this forever. And I'm young enough that I could do something else. And so generally, when people get divorced, they've been married between 6 to 8 years, because it's long enough that folks feel like, well, I've given this a chance, but short enough that people are still kind of young. And statistically speaking, many of those folks have had children, and they're usually young children. They're not college age, they're not high school age so much. They're often young children in early learning programs. That's why it's so important that we're really familiar with information around the topic of divorce, and that we know to expect that, and that we know that we're going to deal with families that are experiencing the pain and grief and difficulty of divorce as they have children moving through our programs, and that we are prepared to deal with the kids and with the families. Divorce is difficult for all parties, absolutely. In grief and trauma scales, it's very high. People they're not at their best when they're going through a divorce. Adults they're not at their best at that time. So try to know that so you can be sympathetic to parents. And also, children are not at their best when they're going through the difficulty of familial disruption. Children's adjustment to divorce generally depends on these factors listed here. Parental psychological health, which, as I said, is very difficult at best. People do not get married hoping or expecting to get divorced. So it's a grievous time. The level of conflict between the biological parents. As I said, when people are grieving, they do not always make great decisions, and usually there's some level of conflict. And how much children are exposed to makes a big difference in how the children experience it. The child's characteristics also make a big difference. For whatever reason, some people are a little more resilient. Some people can tune things out a little bit, but it impacts any child, certainly. But a child's characteristics also have a factor in how they take it. And then the social supports in the family and community, that's crucial. Now here's where you come in, because having a school that is at least sort of sympathetic and empathetic and understands that the family is going through a hard time can be um, very helpful. It's very important to keep judgment out of the classroom when you're dealing with parents at the door. Um, it doesn't mean that you need to be the family's support. You're certainly not paid to be a therapist or anything, but just the little things that you do in terms of making a family feel welcome and making a child feel loved and cared for can go a long way toward providing parents kind of the comfort, like, well, at least I don't have to worry too much about school. At least I know my child's teacher really likes my child. But the other social supports that the family is receiving also, make a huge difference. The average child of divorce spends about 5 years in a single parent home. And then often, as it's mentioned above, about 2/3 of divorced parents do remarry, and about half of those unions do fail. So when we talked about repeated transitions for children, this is the reality of many young kids, that they will be in several different family systems. Okay, on this slide, I talk about blended step and reconstituted families. It makes sense to say that if parents are likely to remarry, then they're and children are going to end up in other family systems, maybe experience one, two, or three different family systems growing up. Then we have to take a look at blended step or reconstituted families. Oftentimes what happens, as I said, is that children will start off with two biological parents, or two, with the two parents that they had at the start, and then if those parents separate, then they are with with a parent or with both parents, 1 week on, 1 week off, and they do that for a while, and then there's a remarriage, then they're in yet another family system. So that's several different systems. Um, It's a difficult adjustment for most children. The most frequent blended or step family is the mother stepfather families, because mothers are more likely to have greater custody of the children. I will say that this is shifting to a 1 week on, 1 week off model, but where we do see that one parent has more custody than the other parent, it's generally the mother that has more custody. In school-age children, what we see in terms of reactions is we see that children they'll start to kind of tune out sometimes. They'll do things like be more irresponsible, they'll act out, engage in antisocial behavior, so negative behaviors. About a third of adolescent boys and a quarter of adolescent girls disengage from their step families and spend little time at home. Adolescents do not handle it very well when they have somebody new coming into the family system. Adolescence is already a turbulent time, and you don't really want to be told what to do. And being told what to do by somebody that wasn't really there when you lost your first tooth, people just don't like that. Adolescents do not like that. They react very strongly to it. Father-stepmother families tend to create greater levels of confusion for children. There's a lot of conflict oftentimes with father stepmother families, because really mothers tend to be at least in a family where there are heterosexual parents, mothers tend to be sort of the influence maker, even between parents, and even between fathers and their own children. They have a lot of influence. So when it's stepmother and father, sometimes it's very difficult, particularly for girls. There's often great conflict between girls and stepmothers. Family life education and therapy can help parents and children. The divorce rate is higher for second marriage than it is for first marriage. This results in further transitions, and children do not have a chance to necessarily settle into the blended family. And the more marital transitions children experience, the more severe and prolonged their adjustment difficulties are. And remember that when we think about this, it's not just adjusting to other parents or other adults in the home that might be telling you what to do. It's also adjusting to the presence of other children that are then competing for time and resources, and that's very difficult. I see sometimes issues with step families, and you might see in your centers where you've got, let's say, two children that are in the same family. It's a blended family, and maybe one child has grandparents from that, from that other parent that give them lots of stuff, and the other child maybe doesn't have that. So you'll see like one kid is getting a laptop at Christmas and the other kid is not, and how that sort of pans out, and that kind of competing for attention within the family, and that's really tough. And that's even when everything else in that actual home that the child lives in seems fair and equitable. So all of this is to say it can be a very trying time for kids, and so you have to know that. Okay, so let's talk about siblings. I mentioned step siblings before, which is a difficult relationship, but even siblings, it's an opportunity for relationship that sometimes can go really well, and sometimes children will need our help to navigate some of that. About 80% of American children grow up with siblings. When siblings arrive, it might be difficult for preschoolers. They might feel resentful of the arrival of this new person. Um, in fact, it's very common. We went through it myself. I remember that when we had my second child, his name is Mark. We brought our older child, John, who was 3 years and 4 months old when Mark was born, and we brought him to the hospital, and we had explained, to him, oh, there's the baby is coming, and we read him books. We did all of the stuff that you're supposed to do. And when we took him to the hospital that day, I said, John, so where is your mommy? And he pointed to me. Where is your daddy? And he pointed to my husband. And I said, where is Mark's mommy? And he said, Mark's mommy is at work. And I said, where is Mark's daddy? Mark's daddy is at work too. So it's very common to have some aspect of kind of jealousy or resentment or difficulty at the beginning. And most families go through it, and most families are able to navigate it. Children need lots of reassurance, and they will need reassurance from you as a teacher when they're going through that also. The frequent and emotional intensity of sibling interactions become unique contexts in which we expand our social competence. In other words, our siblings are our first friends, and they're the first opportunity that we have to learn all of that stuff about friendship that we have to learn to function in the world anyway, like sharing and being nice to others, and if you want to have a friend, be a friend. All of that stuff does occur also with siblings. Our individual differences in the quality of sibling relationships appear shortly after birth. So right away, we start as young children kind of checking each other out as siblings, and how well that goes has a lot to do with how the adults around those families treat the children. Sibling rivalry, there's always capacity for sibling rivalry. Human beings are naturally competitive. And it could really increase in middle childhood especially, even though there's companionship, emotional support, and assistance. So even in the healthiest of families, children do compare themselves and they do compete. Now, when siblings are the same age, or close in age, and the same sex, there's more quarreling, there's more antagonism, they fight more. And this might be due to parental comparisons, but it's not just parents. Teachers also make comparisons too. And children are always watching us too, the teachers and other important adults in their lives, to see, well, do they seem to like my sibling better or me? They're keenly aware of those things. Companionship with one another between siblings may drop over time, but attachment generally remains strong. But it's very important when we look at the sibling relationship that there's really quite an emphasis on not setting those kids up for competition and really making both of them feel valued and really supporting that relationship and really encouraging children to work it out and teaching children how to be friends with one another because the sibling relationship is so crucial. And for those of you that work in multi-age programs and have siblings, I will say to you that there is a ton of research that shows that having strong sibling relationships has implications across the lifespan. People who have good sibling relationships live longer. I mean, there are like even health benefits. I mean, it's a great gift that you can give a human being when you help them to be close to their sibling. And most of that sibling relationship stuff is fully formed between the ages of 6 and 8. So it can be bettered and it can be worsened after that. It can be impacted, but really a bulk of it does happen in the early years. So when I say that what we do in the early learning setting really matters, this is something that really matters. And so when I say to you, if you work with multi-age children and you have siblings in your setting, anything that you do that helps foster a closeness between those siblings, it is going to be something that endures when you are long gone out of their lives and they're not even thinking about it. When they're old, it'll still make a difference. So I would definitely keep that in mind. Okay, adoptive families. Here's some of what we know about adoptive families. We know that most adopted children do fare very well. Domestic adoptions are still more common. Um, During adolescent identity formation, there might be heightened curiosity about biological parents. That's very typical. And in transracial and transcultural adoptions, the parents' efforts to learn about children's ethnic heritage in childhood and to extend opportunities for ethnicity of origin and meaningful contact and fostering openness of exploration of the children's roots are linked to positive outcomes. In other words, families who adopt transracially and transculturally should really make a concerted effort to connect that child to that race or that culture, as well as the traditions of the family that they're growing up in. Make sure that if you have children in your classroom, that you have books and other things that represent kids. Invisibility is a real problem with adoptive families. Oftentimes children feel like, oh, no one else is like me. So you want to make sure that kids see themselves in your materials that you have in your classroom, that they feel recognized, that they feel that there's a mirror for them and not just for all of the other children that have some biological tie to some parent or parents that they live with. Okay, dual earner families, I mentioned before. Over the last 2 to 3 decades, single and married mothers have joined the labor force at a similar rate. So about 68% of all mothers are employed, and during the preschool years, it's about 64%. In middle childhood, it rises to about 78%. Children do benefit from role models of working parents. In homes where mother enjoys her job and is committing to parenting as well, children's adjustment tends to be very favorable. Compared to children of non-working mothers, children of working mothers have higher self-esteem, more positive family and peer relations, better grades, and their beliefs tend to be less gender stereotyped. In other words, they're less likely to think that, gendered work is women's work. So, vacuuming has to be the woman's job, for example. That's what I mean by gender stereotyped. Other things that we know from the research, we know that children in dual earner households are more likely to participate in household chores. We know that maternal employment, mom working, leads to more time with fathers as caregiver, leading to greater achievement, increased social competence, and more tolerance for flexible gender roles. And we know that something that helps with this is having workplace policies that support mother and father roles as caregivers are essential. So health insurance, flexible scheduling, family leave, on-site daycare, things like that. If work places heavy demands on both parents' schedules, sometimes there can be a risk of ineffective parenting. And it generally works better if you have both parents willing to share household and domestic responsibilities.